I'm Dr. Richa Thukral, Senior Consultant Pediatrics and Neonatology at Apollo Hospitals, Noida, and I'm also an asthma and allergy specialist. Today we'll be discussing which test is best for testing for allergies. As we know, allergies in the recent decades have become very common. In fact, 15 to 20% of the adults as well as children suffer from allergies. Allergy is a hypersensitivity reaction which is immunologically mediated to a harmless substance which we call as the allergen. And what are the symptoms of allergy, or what are the symptoms which will make you suspect that you or your child is suffering from allergies? So if you have a nasal congestion, if you have nasal itching, sneezing, rhinorrhea, which is persistent or seasonal, several times a year, then you may be suffering from what is called a nasal allergy or allergic rhinitis. Also, episodes of frequent cough, which are prolonged, especially which increases in the night or on exercise, associated with shortness of breaths and sometimes associated with wheezing. These are signs of allergic asthma. You can also have redness, itching, or tearing from the eyes, which is allergic conjunctivitis, which again can be perennial, that is throughout the year, or it can be seasonal as well. Other signs of allergy can be a itchy, scaly, reddish, dry skin, which we label as eczema or atopic dermatitis. Other allergies can be food allergies. It can be an insect allergy when you react to a bee or a wasp sting. So these symptoms can make us think that maybe you're suffering from allergic disorders. Now, lots of parents come to us, also adults come to us to know why is my child or why am I suffering from allergies? So for this reason, we need to test for allergies because we need to find out what substance or allergen you are reacting to. So in this video, we'll be talking about which tests you should do for allergies. Now, before we go to the tests which we do, we should know we should know, one, that is who should be tested for allergy. Secondly, which allergens should be tested for allergy, and thirdly, which test should be done. So if we come to who should be tested for allergy, then all people who are suffering from moderate to severe symptoms of allergy, which is not controlled on your usual medications, your intranasal sprays or inhalers, they should be tested for allergy. Also, if you have frequent exacerbations during the year and you have severe symptoms, then you should be tested for allergy. Other is in case you want to take immunotherapy, which is a newest treatment for allergy and it can cure your allergies, we should know what allergen we are treating. In case of food allergies, to find out the culprit food, again, a test is essential. And the most important reason for testing for allergy is basically if you have ever had an episode of anaphylaxis. Now, anaphylaxis is a very severe life-threatening episode of allergy, which can be fatal. So for such people, it is imperative to find out what substance you are reacting to. And these people should also carry an epinephrine pen or an EpiPen with them, which they have to inject to themselves to treat this life-threatening reaction. Then the second question is, what allergens do we test for allergies? So in allergens, we can have airborne allergens. They are actually broadly divided into 4 categories. So you can have your airborne allergens. Second is your food allergens. Third is your insect stings. And fourth, of course, is drug allergies. So in the airborne allergens can be indoor as well as outdoor. So airborne allergens are the commonest ones which trigger your allergic rhinitis or asthma. So if we talk about indoor allergens, the commonest is your house dust mite, which is almost prevalent in almost all the houses. Then you can have cat and dog dander if you are keeping pets. You can have allergy trigger can be cockroaches, and it can even be mold. So in damp houses, the spores of the molds can trigger allergy. If we go to outdoor airborne allergens, the commonest is your pollens. So the tree pollen, grass pollen, weed pollen, depending upon the season, depending upon the geographical area, we can test for those pollens which can trigger your allergic rhinitis or asthma. The food allergies, commonest causes are usually your cow milk, it can be egg, it can be peanuts, other tree nuts, fish, and soy. And some people are even allergic to lentils. So these can also be tested by various methods. The insect stings usually is bee and wasps, which again we can test. They can also trigger allergies. And then there are drug allergies. Now we come to the topic of this talk, that is which test should be done for the allergy. So these tests are divided broadly into two categories. So one is what we have a skin prick test, or what we also call as an allergy skin test, and the other are the blood tests. So if we talk about the skin prick test, it is the commonest test which is done for allergies. It has been there for almost 25 years. It is a gold standard test for testing for allergies. It is a very safe test, can be done in the OPD. It is not very expensive, and you get the report within 15 to 20 minutes. How we do a skin prick test is that we have these allergen extracts. So depending upon your clinical signs and symptoms and your history, we choose what allergens, whether it is airborne allergens, food allergens, or pollens. So whatever allergens we need to test, we have these allergen extracts. So we put drops of these allergens on your forearm or the back, and then there is a special toothpick-like device. It's a small lancet with which we prick through those allergens, and we put adequate test and control drops as well. So it is just a superficial scratch which is done, which is absolutely painless, so that the allergen goes into the superficial layer of the skin. So what it does is the allergen binds to your allergy antibody, which is there on the immune cells which are there in the skin, which is the mast cells and the basophils. So if you have the allergy antibody to that particular allergen, there will be a reaction on the skin. So you will have a typical wheal and flare reaction in which there is a swelling, there is itching, and there is redness. It typically looks like a mosquito bite. So in this way, we can test for several allergens at the same time. And within 15 to 20 minutes, we can give you we can find out, depending upon the size of the wheal and flare, we can find out what allergen you are sensitive to. So this is a very sensitive and specific test, and it's a gold standard test for testing for allergies. The other test that we do is their blood tests. So lots of labs offer these blood tests. One blood test which is often misused is your total IgE. Now the total IgE has no benefit in diagnosing your allergy, because the total IgE antibody can be raised even in certain non-allergic conditions like parasitic infestations, in case of viral infections, bacterial infections, certain immune disorders. And also in 50% allergic patients, the specific IgE is not raised at all. So it is only 50% sensitive or specific for testing for allergies. So the take-home message is that total IgE should not be used for testing for allergies. Then we come to the second blood test which we do, which is called the specific IgE. Now the specific IgE actually picks up specific allergy antibodies to the various allergens. And lots of labs offer the individual allergens or panels or comprehensive allergy profile. So in this case, we send a blood sample and it is tested in the lab. And only thing is, it takes almost 3 to 5 days for the report to come. And these are significantly more expensive than the skin prick tests. So to conclude, I would like to say that both the tests, the blood test and the specific and the skin prick tests, are good tests for allergies. Only thing is that you should consult an allergy specialist, and depending upon your history and clinical signs and symptoms, we need to decide which allergens need to be tested and which test needs to be done. So, in the end, I would just like to say that in case you are suffering from nasal allergy or asthma or allergic conjunctivitis, you can consult us at Apollo Hospitals. Depending upon your history and clinical signs and symptoms, we can offer you a skin prick test or a blood test to find out what substance you are allergic to. So after that, the proper management can be done, and we can even offer you immunotherapy, which is the only treatment which can cure your allergies. So for more information, you can get in touch with us at Apollo Hospitals, Noida. Thank you.